Hey there everyone, welcome to my channel, Nurse ME here. I have picked some questions to put your nursing knowledge to the test. If you have any questions, do not hesitate to post them in the comments section and I will respond to you. I passed the NCLEX on the first try and I would love for each one of you to pass as well. Now before we jump into the questions, make sure you hit that subscribe button and give this video a like. And do not forget to drop a comment below sharing how many questions you got right.
A 65-year-old male with a history of hypertension and diabetes mellitus presents to the emergency department with severe right flank pain and hematuria. His temperature is 101, or 38.3 Celsius, blood pressure is 150/90, and heart rate is 110 beats per minute. What is the most likely diagnosis? A. Renal artery stenosis. B. Acute pyelonephritis. C. Nephrotic syndrome. D. Renal calculi. The correct answer is D. Renal calculi. The combination of severe right flank pain and hematuria suggests renal calculi, while the fever indicates possible concurrent infection or inflammation. A 50-year-old female with chronic kidney disease presents with generalized weakness and pruritus. Lab results reveal a potassium level of 6.5 milliequivalents per liter and a calcium level of 7.8 mg per deciliter. What is the most appropriate initial management? A. Administer potassium supplements. B. Administer calcium gluconate 4. C. Provide high calcium diet. D. Encourage increased fluid intake. The correct answer is B. Administer calcium gluconate IV. Administering calcium gluconate IV is the initial management for hyperkalemia as it helps stabilize the cardiac membrane, reducing the risk of arrhythmias. A 45-year-old male with a history of polycystic kidney disease presents with severe headache and sudden onset of visual disturbances. His blood pressure is 210/110. What is the priority nursing intervention? A. Administer antihypertensive medication as ordered. B. Encourage fluid intake. C. Perform a visual acuity test. D. Place the client in a Trendelenburg position. The correct answer is A. Administer antihypertensive medication as ordered. The priority intervention is to lower the blood pressure rapidly but safely to prevent further complications such as intracranial hemorrhage or stroke, which are risks in polycystic kidney disease with severe hypertension. A 60-year-old female with diabetic nephropathy is admitted with worsening edema, shortness of breath, and crackles on lung auscultation. Her BUN is 85 mg per deciliter and creatinine is 4.5 mg per deciliter. What is the most likely cause of her symptoms? A. Hypovolemia. B. Fluid overload. C. Dehydration. D. Acute myocardial infarction. The correct answer is B. Fluid overload. In the context of diabetic nephropathy, elevated BUN and creatinine levels, along with worsening edema and respiratory symptoms, indicate fluid overload due to impaired renal function. A 55-year-old male with a history of end-stage renal disease on hemodialysis presents with confusion, twitching, and a blood pressure of 160/95. His lab results show a serum sodium level of 120 milliequivalents per liter. What is the most appropriate nursing intervention? A. Administer 0.9% normal saline 4. B. Restrict fluid intake. C. Administer hypertonic saline 4. D. Encourage a high-sodium diet. The correct answer is C. Administer hypertonic saline IV. Administering hypertonic saline IV is appropriate for severe hyponatremia to rapidly increase the serum sodium levels and alleviate neurological symptoms like confusion and twitching. A 72-year-old female with chronic kidney disease is admitted with lethargy, confusion, and a potassium level of 7.0 milliequivalents per liter. Which ECG change would the nurse expect to see in this client? A. Prolonged PR interval. B. Peaked T waves. C. ST segment elevation. D. Inverted P waves. The correct answer is B. Peaked T waves. Peaked T waves are characteristic ECG changes associated with hyperkalemia, reflecting the effect of elevated potassium on cardiac conduction. A 40-year-old female with a history of lupus nephritis is admitted with generalized edema and proteinuria. Her albumin level is 2.0 gram per deciliter. Which dietary modification is most appropriate for this client? A. Low-protein diet. B. High-sodium diet. C. High-protein diet. D. High-fat diet. The correct answer is C. High-protein diet. A high-protein diet is recommended to offset the protein loss in the urine and to help maintain oncotic pressure in clients with lupus nephritis and hypoalbuminemia. A 68-year-old male with chronic kidney disease is on a low-protein diet. He presents with muscle wasting and fatigue. What is the most appropriate modification to his diet? A. Decrease protein intake further. B. Increase protein intake with high biological value foods. C. Increase carbohydrate intake. D. Add potassium-rich foods. The correct answer is B. Increase protein intake with high biological value foods. Increasing protein intake with high biological value foods provides essential amino acids while minimizing nitrogen waste, addressing muscle wasting and fatigue in chronic kidney disease. A 75-year-old female with acute kidney injury presents with oliguria and elevated BUN and creatinine. Her urine output is 200 ml per day, and her sodium level is 130 milliequivalents per liter. What fluid therapy is most appropriate for this client? A. Administer hypotonic IV fluids. B. Restrict fluid intake. C. Administer isotonic IV fluids. D. Administer hypertonic IV fluids. The correct answer is C. Administer isotonic IV fluids. Isotonic IV fluids are appropriate to support circulation and renal perfusion without causing rapid fluid shifts, helping manage oliguria and maintain electrolyte balance in acute kidney injury. A 62-year-old male with a history of hypertension and stage 4 chronic kidney disease is admitted with severe dyspnea, bibasilar crackles, and pitting edema. His BNP level is elevated. What is the primary cause of his symptoms? A. Fluid retention and heart failure. B. Hypertensive crisis. C. Pulmonary embolism. D. Acute coronary syndrome. The correct answer is fluid retention and heart failure. Fluid retention due to decreased renal function in chronic kidney disease can lead to heart failure, as evidenced by dyspnea, crackles, and pitting edema, and an elevated BNP level. A 48-year-old male with nephrotic syndrome presents with sudden onset of severe right leg pain and swelling. His leg is pale and cold to touch. What is the most likely diagnosis? A. Deep vein thrombosis. B. Peripheral artery disease. C. Acute limb ischemia. D. Cellulitis. The correct answer is C. Acute limb ischemia. Acute limb ischemia in nephrotic syndrome can occur due to hypercoagulability and increased risk of thromboembolic events. Symptoms like pain, pallor, and coldness suggest arterial occlusion requiring immediate intervention. A 30-year-old female with lupus nephritis presents with increased fatigue, pallor, and a hemoglobin level of 8.5 gram per deciliter. Her blood pressure is 110/70. What is the most appropriate intervention to manage her anemia? A. Administer erythropoietin. B. Increase iron-rich foods. C. Provide folic acid supplements. D. Increase fluid intake. The correct answer is A. Administer erythropoietin. Erythropoietin administration is indicated for anemia in lupus nephritis due to decreased erythropoietin production by the kidneys, helping to stimulate red blood cell production and improve hemoglobin levels. A 67-year-old female with chronic kidney disease presents with worsening dyspnea and an increased jugular venous pressure. Her BNP level is elevated. What is the most appropriate initial diagnostic test to evaluate her symptoms? A. Chest X-ray. B. Echocardiogram. C. Electrocardiogram, ECG. D. Pulmonary function test. The correct answer is B. Echocardiogram. An echocardiogram is crucial to assess heart function, detect heart failure, and evaluate the impact of fluid overload on cardiac performance in chronic kidney disease. A 55-year-old male with stage 5 chronic kidney disease is receiving hemodialysis. He presents with fever, chills, and a painful, erythematous area over his arteriovenous fistula site. What is the most appropriate immediate action? A. Apply a warm compress to the site. B. Administer antibiotics as prescribed. C. Increase the dialysis duration. D. Monitor vital signs hourly. The correct answer is B. Administer antibiotics as prescribed. Fever, chills, and erythema over the AV fistula site suggest a potential infection. Immediate antibiotic therapy is crucial to prevent complications such as sepsis. A 59-year-old male with a history of hypertension and diabetic nephropathy presents with confusion, muscle cramps, and a serum calcium level of 10.5 mg per deciliter. What is the most likely cause of his symptoms? A. Hypercalcemia. B. Hypocalcemia. C. Hyperphosphatemia. D. Hyponatremia. The correct answer is A. Hypercalcemia. Hypercalcemia can cause confusion, muscle cramps, and other neurological symptoms. Elevated calcium levels are associated with conditions like nephropathy and may require management to alleviate symptoms. A 72-year-old female with acute kidney injury presents with oliguria, swelling, and a blood pressure of 170/100. Her BUN is 100 mg per deciliter, and creatinine is 6.0 mg per deciliter. Which medication should be questioned before administering? A. Furosemide. B. Lisinopril. C. Calcium channel blocker. D. Erythropoietin. The correct answer is B. Lisinopril. Lisinopril, an ACE inhibitor, should be used cautiously or avoided in acute kidney injury due to the potential risk of worsening renal function and hyperkalemia. A 65-year-old male with chronic kidney disease and secondary hyperparathyroidism is admitted with bone pain and fractures. His phosphorus level is 7.5 mg per deciliter. What is the most appropriate management for his hyperphosphatemia? A. Administer phosphate binders. B. Increase dietary phosphate. C. Administer vitamin D supplements. D. Encourage weight-bearing exercises. The correct answer is A. Administer phosphate binders. Phosphate binders are used to reduce elevated phosphate levels in chronic kidney disease, managing hyperphosphatemia and helping prevent complications such as bone pain and fractures. A 58-year-old female with stage 4 chronic kidney disease is scheduled for a parathyroidectomy. She has a history of hypercalcemia and severe itching. What postoperative complication should the nurse monitor for? A. Hypocalcemia. B. Hyperkalemia. C. Hyponatremia. D. Hypophosphatemia. The correct answer is A. Hypocalcemia. Postoperative hypocalcemia is a common complication after parathyroidectomy due to the sudden decrease in parathyroid hormone levels, requiring close monitoring and management to prevent symptoms like tetany and seizures. A 70-year-old male with a history of hypertension and chronic kidney disease presents with severe abdominal pain and vomiting. His potassium level is 6.8 milliequivalents per liter, and ECG shows peak T waves. What is the priority nursing intervention? A. Administer sodium polystyrene sulfonate, calculate. B. Prepare for dialysis. C. Administer a beta blocker. D. Restrict dietary potassium. The correct answer is B. Prepare for dialysis. With severe hyperkalemia and ECG changes, the priority is to rapidly reduce potassium levels. Dialysis is the most effective method to quickly lower serum potassium and manage the associated life-threatening cardiac complications. A 62-year-old male with diabetic nephropathy presents with lethargy, nausea, and a blood pressure of 180/100. Lab results show BUN of 80 mg per deciliter and creatinine of 5.0 mg per deciliter. Which medication class is most appropriate to manage his hypertension? A. Beta blockers.
B. ACE inhibitors.
C. Loop diuretics. D. Calcium channel blockers. The correct answer is
B. ACE inhibitors. ACE inhibitors
are effective in managing hypertension in diabetic nephropathy due to their renoprotective effects and ability to reduce proteinuria, helping to control blood pressure and slow disease progression. A 55-year-old male with end-stage renal disease, ESRD, on peritoneal dialysis presents with cloudy dialysate and abdominal pain. What is the most likely cause of his symptoms? A. Peritonitis. B. Intestinal obstruction. C. Urinary tract infection. D. Catheter occlusion. The correct answer is A. Peritonitis. Cloudy dialysate and abdominal pain in a patient on peritoneal dialysis suggest peritonitis, a serious complication that requires prompt antibiotic therapy to prevent sepsis. A 68-year-old female with a history of chronic kidney disease presents with increased lethargy, swelling, and a serum sodium level of 120 milliequivalents per liter. Which of the following is the most likely cause of her hyponatremia? A. Fluid overload. B. Increased sodium intake. C. Excessive diuretic use. D. Low protein intake. The correct answer is fluid overload. In chronic kidney disease, fluid overload can dilute serum sodium, leading to hyponatremia and symptoms such as lethargy and swelling. Management involves fluid restriction and addressing the underlying kidney issues. A 50-year-old male with a history of renal calculi presents with severe flank pain, hematuria, and nausea. What is the most appropriate immediate intervention to manage his pain? A. Administer NSAIDs. B. Encourage oral hydration. C. Provide intravenous morphine. D. Apply a heating pad to the abdomen. The correct answer is C. Provide intravenous morphine. Intravenous morphine is effective for managing severe pain associated with renal calculi, providing rapid relief compared to NSAIDs or oral hydration. Heat application can be supportive but not as immediate. A 45-year-old female with chronic glomerulonephritis presents with generalized edema, a blood pressure of 150/90, and a serum albumin level of 2 gram per deciliter. What is the most likely underlying cause of her edema? A. Increased capillary permeability. B. Low oncotic pressure. C. High blood pressure. D. Increased lymphatic drainage. The correct answer is B. Low oncotic pressure. Low serum albumin levels reduce oncotic pressure, leading to fluid leakage into tissues and generalized edema in conditions like glomerulonephritis. Management includes addressing the underlying disease and improving protein levels. A 60-year-old male with acute kidney injury due to sepsis presents with hyperkalemia and a serum potassium level of 7.2 milliequivalents per liter. Which medication should be administered immediately to stabilize his cardiac membrane? A. Insulin with glucose. B. Calcium gluconate. C. Sodium bicarbonate. D. Kexolate, sodium polystyrene sulfonate.
In order to test your knowledge, I'm going to skip the answer for this question. Pause the video and type your answer in the comments section below.
A 35-year-old female with polycystic kidney disease presents with severe headaches and blurred vision. Her blood pressure is 190/110. What is the most appropriate initial medication to manage her hypertensive emergency? A. Lisinopril. B. Sodium nitroprusside. C. Hydrochlorothiazide. D. Amlodipine. The correct answer is B. Sodium nitroprusside. Sodium nitroprusside is effective for rapid blood pressure reduction in hypertensive emergencies, helping to prevent complications like stroke or organ damage in patients with polycystic kidney disease. A 70-year-old female with advanced chronic kidney disease is receiving hemodialysis and presents with muscle weakness and cramping. Her serum calcium level is 7 mg per deciliter. What is the most likely cause of her symptoms? A. Hyperphosphatemia. B. Hypokalemia. C. Hypocalcemia. D. Hypermagnesemia. The correct answer is C. Hypocalcemia. Hypocalcemia is common in chronic kidney disease due to impaired vitamin D metabolism and reduced calcium absorption, causing muscle weakness and cramping. Supplementation and monitoring are necessary for management. A 64-year-old male with diabetic nephropathy presents with foot ulcers, proteinuria, and a serum creatinine of 3.5 mg per deciliter. His blood pressure is 145/85. What is the most appropriate antihypertensive agent for his condition? A. Metoprolol. B. Lisinopril. C. Amlodipine. D. Furosemide. The correct answer is B. Lisinopril. Lisinopril, an ACE inhibitor, is preferred for managing hypertension in diabetic nephropathy due to its ability to reduce proteinuria and provide renal protection, helping to control blood pressure and slow disease progression. A 55-year-old male with autosomal dominant polycystic kidney disease, ADPKD, presents with hematuria, back pain, and hypertension. His serum creatinine is 2.8 mg per deciliter. What is the most appropriate diagnostic imaging to assess his renal condition? A. Ultrasound. B. Magnetic resonance imaging, MRI. C. Computed tomography, CT, scan. D. X-ray. The correct answer is A. Ultrasound. Ultrasound is the preferred initial imaging modality for evaluating renal cysts in ADPKD, providing detailed visualization of kidney size, cyst characteristics, and potential complications without exposing the patient to radiation. A 62-year-old female with nephrotic syndrome presents with generalized swelling, foamy urine, and a serum albumin level of 2.1 gram per deciliter. What is the primary treatment goal in managing her condition? A. Reduce protein intake. B. Decrease sodium intake. C. Control hyperlipidemia. D. Increase dietary protein. The correct answer is D. Increase dietary protein. Increasing dietary protein helps counteract the protein loss in nephrotic syndrome, aiming to improve serum albumin levels and reduce generalized swelling. Management also includes addressing underlying causes and complications such as hyperlipidemia and edema.
Thank you very much.